Good morning, everyone. And this one is the last lecture about anemias, and this lecture will basically cover in detail aplastic anemia. As you know, like in the previous lecture, what we had discussed is like when there is normocytic anemia. What we have to do, we check the MCV. When the MCV is like between 80 to 100, we say it's a normocytic anemia. Then we check the reticulocyte count. If it is more, then the causes can be the hemolysis as well as hemorrhage. And when the reticulocytes count is not more, like rather there is no reticulocytes, so it means what is the cause? The cause is simply can be pancytopenia or non-pancytopenic. Like when the reticulocytes count is low, we further classify it into either pancytopenic as well as non-pancytopenic. So simply, to start with, we are discussing normocytic anemias, and this one is in the continuation of that thing. So, of course, normocytic anemia, the MCV is between 80 to 100. What you will check is reticulocytes counts. Just give me 1 second. Okay, so reticulocytes count, and when reticulocyte count is not, or is like there is decreased production, simply decreased production of RBCs, then we see either like one cell line is only gone or all. So when just one cell, when all cell lines are gone, we call it as pancytopenia, and when one cell line is gone only, non-pancytopenia. Okay, so what are the causes of pancytopenia? In this one, the most important one is aplastic anemia. Aplastic anemia. Okay, to tell you, like this is the most common, most important one which we are going to cover. Then there can be myelodysplastic syndrome. Okay, then there can be myelofibrosis. Okay, these are the causes. Then it can be leukemias. It could be due to TB. It could be due to some, there is some conditions which are called as infiltrative conditions. What happened in those is like basically the bone marrow is infiltrated by other tissues. For example, amyloidosis or sarcoidosis. Okay, so what is in this one? Like the bone marrow is infiltrated by some other tissue, and it cannot produce the normal cells. Drugs, and in drugs, the most important drugs to remember is chemo uh, therapeutic drugs. Okay, like anyone due to cancers, they are taking chemotherapy. It can lead to aplastic anemia, and yes, that's like these are the causes of non-pancytopenic anemia. In non-pancytopenic type, again, this one, like in which only the red blood cells are gone, as I told you already, guys, that anemia of chronic disease in its mild and moderate form gives normocytic type of anemia, but when like it becomes severe, it becomes microcytic. And for example, renal failure. Now, in renal, what the kidney, one of the function of the kidney is producing uh, erythropoietin, and of course, like when the kidney is not producing erythropoietin enough, so what happens? Like the red blood cells will be decreased, and that's why, like whenever we treat renal failure or the management of renal failure, we give the patients what you can say is erythropoietin. Okay, so of course, like we are going to discuss first of all aplastic anemia, and in aplastic anemia, uh, the important things which I will be talking about again is like the definition, etiology, and like the same way how we uh, like study all the other anemias. So, what is aplastic anemia? Simply, there is uh, destruction of like all the hemopoietic cells of the bone marrow, or you can say simply the bone marrow become hypocellular. Okay, the bone marrow become hypocellular, like all the cells. Okay, all the cell lines are decreased and all the cell lines cannot be formed, and of course that will lead to what you can say pancytopenia. It could be hypocellular bone marrow, it could be, you can say, destruction of all the hemopoietic stem cells. Simply, when there will be no stem cells, of course, like there will be no what you can say cells in the body. One of the thing, whenever like it comes to normocytic anemia, a very good mnemonic, guys, to remember the causes of normocytic anemia. You can remember it by the way of ABCD. A is for acute blood loss, B is for bone marrow failure, C is for chronic disease, and D is for destruction. Destruction means what? Hemolysis. Like whenever anyone have normocytic anemia, okay, we can remember it by which mnemonic? We can remember it by simply A, B, C, D. So what is A? Acute blood loss. What is B? Bone marrow failure. What is C? Chronic disease. And what is D? Destruction. Okay. Destruction means what? Hemolysis. So, um, like the same thing, myelodysplastic disorders or myelofibrosis or sarcoidosis or amyloidosis, they are causing the destruction of bone marrow simply. So, what is the etiology of aplastic anemia? Is simply uh, etiology of bone aplastic anemia. First of all, it could be congenital and it could be acquired. Okay, so in congenital, uh, if you cannot remember like much things, just remember one very important one: Fanconi's anemia. Okay, there is one more cause of aplastic anemia, congenital form, which is called as um, Swashman Diamond syndrome. But like Fanconi's, that's more than enough if you remember Fanconi's anemia. What is Fanconi's anemia, guys? Fanconi anemia is a genetic disease simply, and there is basically DNA damage is there. Okay, it's not so common; it's very rare. Okay, so what happens is like basically um, like it's genetic and the patients, they have some like abnormal gene or mutated genes. Okay, uh, it's autosomal recessive condition, and uh, like it is the most common, you can say, people who have this Fanconi's anemia, who have like increased chances of Fanconi's anemia, are basically Jews. And what is the pathogenesis? You can say like simply due to that abnormal DNA or abnormal gene or mutated gene, what happens is like they cannot make the cells. Okay, and simply there is bone marrow failure. Okay, so of course at birth like their cells count will be normal because at that time of course like you're going to they are going to get everything, but like mostly in the first 10 years of their life, what happens like they started presenting with pancytopenia, like uh, anemia with thrombocytopenia with leukopenia simply. So uh, Guys, remember, whenever there is like absence of red blood cells or like less red blood cells, there will be features of anemia. But someone who have a decreased level of platelets in their body, they will be having bleeding problems. Whereas whenever someone have decreased level of white blood cells, what they will be having is repeated infections. Okay, so acquired causes of you can say this fan this sorry this aplastic anemias are many, like for example idiopathic, like we don't know anything about this one. Certain drugs, for example, what type of drugs? I already told you, chemotherapeutic drugs. Okay, when someone is getting treatment for the cancers, they are at risk of getting this thing. Chloramphenicol, very old antibiotic, as well as antimalarials can cause. Okay, many other drugs can cause, but of course, like, no need to remember everything. There can be many toxins which can fail the bone marrow. Okay, benzene, okay, or insecticides, simply insecticides. Of course, there are other toxins as well. Radiations can lead to failure of bone marrow, as well as post-viral infections. Now, this is something, if you remember, like in pediatrics, I talk about parvovirus B19 infection, slap cheek syndrome. These, like, they can lead to aplastic anemia. Just any virus can cause. Epstein-Barr virus can cause, and HEV virus can cause, hepatitis B virus can cause. Okay, so there are many viruses. Okay, and human herpes virus can cause as well, and of course HIV virus can cause as well. So there are many viruses by which can cause this thing. Autoimmune immune destruction of what you can say bone marrow can also occur. Okay, like in autoimmune condition, for example, systemic lupus erythematosus. Okay, of course, other autoimmune can also cause, and there are other causes as well of aplastic anemia, like in pregnancy, it can occur, as well as anorexia nervosa. Now, okay, these things are not so common, guys, but of course, we have to talk about everything when we discuss this thing, like when we are discussing aplastic anemia. So how these patients, they present clinical features, uh, like all these patients, who have aplastic anemia, they have like decreased cell line of, like, all the cell lines. So symptoms will be simply symptoms of anemia will be there. Okay, we will get features of anemia. Again, like, what are the features of anemia, right? um, we will get the features of thrombocytopenia, and simply, like, as the platelets are less, so what will happen? It will lead to you can say uh, bleeding. Okay, ecchymosis and petechias and all those things. And the features of, what you can say, white blood cells, decreased white blood cells will lead to infections. Okay, so simply, these are the patients who present with the signs of anemia. They will be having bleeding, will be having repeated infections. Okay, and rest, like, there will be the features of the underlying cause. For example, someone who is using drugs, they will be having other side effects of these drugs. And someone who have post-viral infection, they will be having features of these infections. someone who have due to autoimmune destruction, so they will be showing the features of what you can say any condition in autoimmune condition. Someone, for example, who is taking therapeutic drugs, okay, and all this stuff. So maybe you will find malignancies, like features like lymph node swelling or lymph uh, adenopathies, okay, or pathy, like they're swelling. There will be swelling of the lymph nodes as well as splenomegaly, okay. Like of course, like if it is in response to some cancers, okay, blood cancers, for example. So how we diagnose, not the congenital one, but someone who have, you can say, aplastic anemia, the acquired one. So of course, we first of all we look for all the causative uh, things. Okay, for example, if the patient is pregnant, if the patient is taking any drugs, if the patient have exposed to any radiations, any toxins, uh, either the patient is taking any antimalarials or all these things. And if we cannot find any cause, of course, we name it as uh, idiopathic. So of course, like how you are going to get like this thing, you will go for a CBC, and what you will find is like decrease uh, RBCs as well as decrease platelets as well as decreased white WBCs, right? So simply you will get anemia with neutropenia, with thrombocytopenia, okay, and when you will check the reticulocytes count, it will be less, okay, it will be less than 1% of the total RBCs count. Uh, so we can do ESR, we can do CRP to check for any infections, okay. We can do blood film simply to check like either there is any abnormal shaped RBCs. Of course, like because uh, aplastic anemia or like you can say pancytopenia can be caused by different uh, myelodysplastic or bone marrow disorders. So in this one, bone marrow biopsy is very important, of course, to look for other causes. So bone marrow biopsy we will go for, okay. What the bone marrow mostly show in aplastic anemia is like aplasia. Of course, like there will be no cells, okay, or you can say hypoplasia. Cells will be there, but like too less, okay, with fats replacing the bone marrow tissue, replacing the tissue, okay. Which tissue? Of course, bone marrow tissue, okay. So this is we are going to found in the patients of aplastic anemia. So as far as treatment is concerned, guys, treatment or management, see what are the things we have to treat. What should be the treatment guidelines? Again, if you will think sensibly, first of all, stop the offending uh, agent. Okay, if it's a drug, stop that. If it's a toxin, stop that. So, like of course, like whatever is causing aplastic anemia, for sure, like we are going to stop that. If the anemia is very severe, what is needed? Emergency blood transfusion, right? You are going to transfuse them with the blood. Blood transfusion should be done, and of course, like they have increased chances of infection. So what you will give them? Antibiotics, of course, like to decrease the infections. Okay. So, for example, if what you can say, if for example they're bleeding, okay, so what we can give them, we can give them plasma concentrates and things like this, okay. So one thing, for example, in the patients, if you cannot find any cause, and what is your diagnosis? Of course, like in aplastic anemia, if you couldn't find any cause, so we label them as idiopathic aplastic anemia. Like when we fail to find the cause, we say it's the idiopathic causes there, right? So in this one, one thing which we can try is called as immunosuppression. Basically, because we don't know the cause of this one, so what we try is for idiopathic aplastic anemia, we try immunosuppression. Okay, of course, many people they respond when we give them anti thymocyte globulin. Okay, the response is good in this one. Or you can give them for cyclosporin, okay, to suppress their immunity. But guys, in this one, like aplastic anemia, if there is no response, especially like you suppress the immunity, there is no response. But of course, like you can give the patient the blood transfusion with antibiotics, but how long? Then this is one of the cause in which we can do bone marrow transplant. Okay, we transplant them with the bone marrow so that like they have their own bone marrow, and like they have their like someone's bone marrow which can produce blood for them. Okay, so like this is what you can say is a treatment for aplastic anemia. Nowadays there is a lot of growth factors injections are also available, but we don't have much evidence, by the way, either they were good or not. Okay, so that's why the first line you can say for uh, anyone who have idiopathic aplastic anemia is immunosuppression. Okay, either by antithymocyte globulin or either by uh, cyclosporin, or of course like these are combined with corticosteroids, cor, cor, corticosteroids. Okay, for these patients. And but of course like bone marrow transplantation is the solution. Okay, and like once you are going to give them bone marrow transplant, they are going to help them the most. But what is the complication of bone marrow transplant, by the way? That is called as graft. Like this is the complication: graft versus host disease. What happens is like because you are putting someone's bone marrow in the patient, so what happens? Like that bone marrow can start producing cells which will start attacking the all the body tissues, the receiver body tissues. We call it as graft versus host disease, guys. So what you can say to avoid this thing, whenever we provide with see when we transplant someone with a kidney, what we do is like after putting the kidney in someone's body, we give them immunosuppressants. Okay, why? Because we want to suppress their immunity. If we will not suppress their immunity, their immune cells are going to destroy that kidney. So in this one, because we are giving the bone marrow of someone, so of course that bone marrow can make cells which can damage the receiver's body tissues, like all the body tissues. Okay, the condition can become more serious, you can say. So whenever we transplant anyone with bone marrow, it is always taken by a sibling. Okay, the donor are mostly a sibling, brothers sisters, because they have the best match. Okay, HLA tissue typing, or MHC, major histocompatibility compatibility complex, or human leukocyte antigens. Of course, like uh, the sibling which have the best match, we provide them with that thing. So like this is the treatment of what you can say the patients. Okay, nowadays like newer treatments are there, but of course like beyond our scope simply. So what they do, like by the way, after transplanting anyone with the bone marrow, they keep on checking the CBC. They keep on checking the blood count, how the patient is performing. Okay, and of course like just to see if, for example, the patient is improving or not. So of course, like if you are not going to treat this condition, because there is risk of infection, bleeding, as well as anemia, the mortality is very high. Okay, but like nowadays, the survival is good. Like especially after bone marrow transplant, the survival of these patients is very good. things are working fine with these patients. Okay, so this is about aplastic anemia, guys, and as we know, like there are other causes of pancytopenia like MDS. What is MDS? It's basically myelodysplastic syndrome. So of course, like this is a type of cancer, in which like basically the cells in the bone marrow are abnormal. They don't mature normally. Okay, and simply when they don't mature normally, they cannot function normally. So what happens? Like they have the same features. They cannot produce normal RBCs. They cannot produce more normal WBCs. They cannot produce normal um, platelets. Okay, so they have the same symptoms like aplastic anemia, and treatment is somehow same like stem cell transplantation for these patients. And again, the same thing, like until you are planning for the stem cell transplantation, you will keep on giving them blood transfusion, antibiotics, okay, and all these things like which we are doing for aplastic anemia, right? So like these are like myelodysplastic syndromes. Like of course, there's a lot of causes behind that. Okay, there is a lot of causes behind that. Many drugs can cause, and many toxins can cause again myelodysplastic syndromes. Uh, and other than that, like for example, myelofibrosis, as the name shows, guys, like what will happen in this one? Like the bone marrow, the normal bone marrow is replaced with fibrous tissue, and like cirrhosis is the fibrosis of liver. So what happens? Uh, Fibrosis is also called as a scar tissue. Whenever there is a wound, so whenever it will be healed, it is going to form a scar over there. But of course, like the fibrosis or the fibrous tissue, of course, it cannot function properly. So that is called as myelofibrosis. Of course, like the bone marrow is replaced with the fibrous tissue, and it will not function properly. Okay. So as far as the symptoms are concerned, same thing, guys. No different. Anemia, repeated infections, petechias, purpuras, because of platelets are not there. So they present it the same way, and how we treat them is like the same thing: stem cell transplantation. Because when the bone marrow cannot work, bone marrow is not producing any cells, bone marrow is not functioning well. So the ultimate treatment is stem cell transplantation. Okay, and before that, of course, like all these are supportive measures. If you are giving blood transfusion, if you are giving like all these things, they are of course like supportive things. Like, but the main thing is like we have to perform bone marrow transplant. So in myelofibrosis, there are what you can say other treatment options are also there. You can say nowadays, anti-monoclonal therapies are there, and we can try dexamethasone like corticosteroids, or we can give them hydroxyurea. But like of course, what you can say, the ultimate treatment stays uh, allogenic stem cell transplantation. That is the most important thing we can do to these patients. Sometimes we perform a splenectomy as well, because spleen is a site like which destroy the cells. Okay, so uh, like especially these patients of aplastic anemia or myelodysplastic syndromes or myelofibrosis, what happens is uh, there is increased dissection of the cells by the spleen, or what the condition which we simply call it as hypersplenism. The spleen becomes so enlarged. So what they do, like they simply um, remove the spleen. Okay, they take out the spleen. Splenectomy is done. Rest is amyloid. See, what is TB? Tuberculosis. It can affect any part of the body. So if the tuberculosis is going to invade, you can say, the bone marrow. Of course, the bone marrow cannot function properly. So of course, like this amyloidosis or sarcoidosis, guys. Again, you are going to study these two conditions as a separate conditions. And what happens, like, again, there is abnormal tissue infiltration of bone marrow by abnormal protein in amyloidosis. So that's all about what you can say the normocytic, pancytopenic, and non-pancytopenic type of anemias, and that's the last topic which we have to cover up for anemias. So, uh, of course, the next topic which we will start with will be like, of course, like hematology, which will be like the clotting abnormalities. Okay, thank you so much.